Hi guys, this is my 34-week pregnancy update. I am 34 weeks and 3 days today. Before I start the video, I was just gonna say she's gonna be 4 in July next month, is in the room with me. She's on my bed playing on the Kindle, so if you hear noises from that direction, then that's why, because she's in here with me today. I will just start off with, I had a midwife appointment yesterday, so at 34 weeks and 2 days I had an appointment and everything went really good. I gained 2 pounds since my last appointment at 32 weeks, so that's like a pound a week, which I guess isn't too bad. And they checked my blood pressure. My blood pressure is still good. They checked one thing they started doing at my last appointment was checking my urine to make sure there's like no protein and stuff in it, and that was good, so no problems there. Yeah, so blood pressure and urine were fine, and she did check the position of the baby and he is head down, which is great, yay. So hopefully he will stay in that position and he will not move, so fingers crossed that he'll just stay head down and there will be no issues there. It was fun at this midwife appointment because the midwife that I got to see, midwife that delivered my last baby, Emma. So that was kind of fun to get to see her again because I haven't seen her since she delivered her. She actually ended up having twins like 5 months ago, a boy and a girl, set of twins. So she's been busy with that and she's just kind of getting back into work now. So it was fun to be able to see her for this appointment, and it's been a while, so I really like her. She's my favorite one, so I'm hoping that she'll be the one that gets to deliver him. So one thing I got done at this appointment too is I got the whooping cough, or the Tdap shot. They started when I had my last baby. They just gave it to me in the hospital, but I guess they have started giving them to you while you're still pregnant. So I had that done and it's made my arm kind of sore, but that's okay. So I had the shot done and that's all taken care of and out of the way. A few things that she said that will happen at my next midwife appointment, which I think is on July 15th, so in 2 weeks. This will be the last time I go in 2 weeks, and then I start going every week, which is crazy. I cannot believe that I am like this close to going every week. So yeah, so I'm really excited for that. So the next appointment in 2 weeks, she said some things will happen. She said that I'm going to start having and coming in for an NST, or a non-stress test. If you don't know what that is, it's just where they hook you up to monitors and they monitor the baby's heartbeat and if you're getting any contractions and like fetal movement. Like when I've had them done, they always just give me a button to push every time I feel the baby move. So I'm supposed to go in and have that done, which is like for 30 minutes, and then I'm supposed to have an ultrasound right after that, just to check, you know, the amniotic fluid and make sure everything's okay there. And then after that, then I will see the midwife, where they will do the fun old Group B strep test, which if you don't know what that is, they just take like a long, looks like a Q-tip kind of, it's a long Q-tip, and they just wipe kind of the inside of your girly bits and then they send it to the lab to make sure that you're not Group B positive. Now sometimes you do test positive for Group B and other times you don't. My last baby, I did test positive for her, so I had to have the antibiotics while I was in labor, but she's the only baby that I have tested positive for. So I'm hoping that I will not test positive for that, because I really don't want to have to worry about having the antibiotics and all that kind of stuff. So it'll be kind of fun to be able to see him on ultrasound again, and I'll be doing the NST and the ultrasound every week till he's born. So, and she also said that if I wanted them to, they could check me at my next appointment at 36 weeks to see if I'm dilated at all. So I don't know, we'll see. If I might have her check, just because she's going to be in that area anyway with the Group B test, so I might just have them check anyway, but I don't know. So that will be interesting to see what's going on. Okay, so symptoms this week. I've had itchy belly like crazy. My belly has gotten so itchy, and it's just like right above my belly button that's been itchy. But I've been trying really hard not to scratch it because I haven't gotten any new stretch marks this pregnancy. So I just try to not really scratch it, but if I do, it's just kind of through my shirt, so it's not on my my bare skin. Emma wanted to say hi. Say hi.
Hi.
Are you excited to meet your baby brother?
Yeah.
Yeah, you so excited?
Yeah.
You got to go with me today and you heard his heartbeat, huh?
Yeah. And I just helped that lady.
You helped the lady. Yeah, the midwives are so fun there. They always let her help with the Doppler and put it on my belly and listen to the heartbeat, huh?
Yeah.
Yeah.
And that's fun.
That's fun.
Yeah. It's so good with this.
Is that your picture you drew?
Yeah.
Yeah.
That's cute.
Yeah, my brother and his wife just had their baby boy like 3 days ago, so we're gonna go down there later today and see him, huh?
Yeah.
And they have another little boy that's her age, so she drew him a picture to take, huh? That's so nice of you. Okay, can you say bye?
Bye.
Okay, so the next symptom that I've been having is some more sciatic nerve pain, and it'll just come at random times of the day. Like I'll be fine, and the next minute I'll be walking and I'll just have that pain that just shoots down my left leg. And sometimes it only lasts for like 30 minutes to an hour and then it goes away. And then there are some days where I don't have it at all, or some days where I have it like a couple times throughout the day. So it's not very fun because it can be painful. But I just think that it's part of the back problems that I have been having, and that is one reason why I'm going to do a video on why I am not having an epidural with this delivery. I feel very strongly that I should not have an epidural. So, and it's not because I feel like I need like a medal or anything. It's just purely because of some things that I've researched on. So I'll do another video on that. But anyway, so I've been having some sciatic nerve pain. Another symptom that I've been having, which I talked to my midwife about, is sometimes when I wake up in the night to go to the bathroom, like my right hand will be like completely numb, like it'll be like asleep numb, like where, you know, if you like rest your head on your hand for too long, it'll fall asleep. And she says that that's normal. She says it's probably just the way a baby's laying in there, and the weight's probably just compressing on something that the nerve has to do with that arm that will turn it to where it goes numb. She said as long as it comes back to when you get up and move around, then it's okay, and it does. It's just weird. And it'll happen sometimes in the day too, like if I'm sitting for a long time, it'll start to kind of turn numb. And sometimes it'll even happen in my foot. So she says it's totally normal, but she says it will completely go away once he's born. So I'm not really like that bothered by it, but it is kind of weird sometimes to just randomly have your hand fall asleep. And one thing that I've noticed with my belly, where he is head down now, because he actually had flipped back to sideways, and now that he's head down again, I can totally tell, because my belly used to just feel so wide out this way, where now it's like more up and down, and I feel so much more pressure down below than I did before. And when he gets the hiccups, which it's another thing, he has been getting the hiccups all the time. He gets them like 4 or 5 times a day. But the placement of the hiccups where I feel them has changed. I used to feel them when he was sideways, I used to feel them down low on my right side, and now I feel them up higher on my left side. So, and that makes sense, because that's why, because he flipped head down. So one thing that we are going to be doing this week, because I've started getting things ready for him finally. We're actually going baby shopping this Friday, which is the day before the 4th of July. So my husband has that day off from work, plus, you know, the regular weekend he has off too. So we're going to go shopping on Friday for him and finish getting things that we need for him. But one thing that we're going to do is stop by our hospital and pre-register. If you guys are pregnant and you can pre-register at your hospital, I highly recommend that you do, because that way when you're in labor, you don't have to stop and register, because nobody wants to deal with that when they're in labor and having contractions. So we're gonna get pre-registered, so that's all done and over with.
Thank you, Mommy. Please subscribe.
Okay. One thing that I picked up this past week, and if you follow me on Instagram, you've already seen it, but I found my hospital bag. So I thought I would just go ahead and show it. This is what it looks like. It's really cute. It's like a blue and like off-white chevron print, and it has the 2 handles here and then like a big one here. So, and I've started buying a few things for it that I have in here, but I plan on doing a what's in my hospital bag video. I'll probably do that at like 36 weeks, so in about 2 weeks from now I'll do that. Plus I will do a what's in the baby's diaper bag video as well. So that's really it for this update. A couple videos that I will be doing soon, which I mentioned in the past, is obviously the why I'm choosing not to have an epidural and my birth plan video. But another one I will be doing is a tips for new moms video. So stay tuned for those. And plus I will be doing a video on the 4th of July. I will be vlogging and doing a little video for that day. So this is my favorite holiday and I'm so excited for it. Alright, so thanks for watching, and please make sure to subscribe if you haven't to follow my journey, and I will talk to you guys all in the next video. Bye! Do you want to say hi?
Yeah.
You gotta go finish your show.
Hi. I just like one and wait, I go practice.
Okay, honey. Oh, I need to finish talking, okay?
I go and this is what
Okay, go walk, go play in the kibble so you can finish, okay?
Sorry.
It's okay, baby. Taken care of.
I don't feel one. Let me do one more thing, okay?
What?
This one I have more.
Good. Both hands. Okay. Good job. Okay, let me finish. And I will be doing don't touch the camera.
And
Shh, don't touch the camera.
big Mario, you big booty. You big squishy